I know that you've probably taken leadership courses before and classes before, so nothing of what I'm probably going to say from a leadership standpoint is new. Probably you've taken things even more than what I'm going to give you, but the angle of this leadership part is from the burnout part, okay? So let me start sharing my screen. Do that, okay. So, are leaders born or made? Nature or nurture?
Both, of course.
Thank you. Both. All right. Take a few seconds, write down the definition of leadership for you, please. We don't have to write it down, just think about it, because I will ask you about a definition. And I know there are 1,001 ways to define leadership. I will pick on Jordan. What's your definition of leadership?
So I think a leader or leadership is for somebody who's in a role of authority or a role of power, and they can affect change either through their own kind of behavior, or if they're a poor leader, through words instead of actions.
I heard authority, power, and someone who affects change, whether positively or negatively. Okay. Anybody else? Christina, your definition of leadership?
Someone who takes responsibility and directs the team and sets a good example for others.
Okay. Is it difficult to define leadership, you think? Or is it not something, if I say, you know, it's not clear cut probably. We may have a general idea of what it is, but it's really not clear cut. And I think what helps it is if whatever you're doing. So if you think that it's not clear cut, imagine what others will think about it. And for sure, you know, people expect things from leadership. There's an expectation that comes and say, oh, you're the owner, you're the leader, you're the captain, you're something, and we expect certain things from you. And to go to Jordan's definition, someone who exacts change, right? A leader is one who acts as a change agent in actions and ideas. For this to happen, there must be movement from one level of consciousness to another. So it's a change, which is something we've been talking about, and it's actions and ideas. So not only do you have to know how to think, but you also have to translate what you think. And so in a way, what I'm asking you to do, since all of this is about change, is to be your own leaders in that manner. It challenges the status quo. Challenging the status quo is a requirement for leadership. If you're going to move, you're going to have to change. It's like, if everything's great, why would I move? Manifesting the ability to be a leader is the essence of leadership. So not only are you in a position, and someone said, I think it was, what's his name? In a TED talk. I probably remember his name. He says, leadership is not a position or a title. It's a performance, something you do. The definition of leadership is exercising the ability to be a change agent in one's environment. Okay? In that sentence, you have to exercise the ability. So it's an ability, it's learned. You have to exercise it to be a change agent in one's environment. If you take that sentence, you can probably put it anywhere you want. From a patient, to your relationship with the patient, to your relationship with yourself, to everybody else. To act is to perform an action. Action is the end result of a series of events that occur on a cognitive and emotional level, right? So you got the behavior, You got emotions, you got cognition. Why is this important? Let's take a step back. If people impact others, and we say that people quit their bosses, not their jobs, like we said, and leadership is so important, and leadership stems from, like any other human behavior, it's an act, it's an action, so it's a human behavior. But what directs that human behavior is emotions, EQ, and cognitive abilities. Stands to reason that anything that affects those things affects the leadership performance. And therefore, you now start to see the tie-in of burnout to leadership. And it's a reciprocal thing. Burnout can negatively impact leadership, and leadership can negatively impact burnout or positively impact burnout. And that action, once you take it, it's a direct reflection of who we are at the moment, what we're trying to do or perform, and how we perform, and it's at the moment. And then we respond to our own acts. The more powerful and impactful the action, the more the response, be it a negative or a positive one. And when we respond to our acts, others respond also to them. So if you're going to ask yourself, I need to change my behavior and I need to exercise, and I made that decision, if I make that decision that I think I'm going to do it versus I am doing it, it impacts us differently. So if we are change agents, all behaviors have a frame of mind that is made up of values, beliefs, identity, intention. The key to creating change is to address that frame of mind, or else all the change attempted will be brought back and resisted. Intrinsic motivation, long lasting. And when I say intrinsic motivation, it goes back to all of these values, beliefs, identity, and intention. So really, even though you can carry out orders, or you can make sure that people carry out your orders by saying, okay, you have to finish the EMR, but that's not leadership. That's just ordering somebody to do it. There's a big difference. So if you think about it, what are some of the factors that are influencing decision making? Cognitive biases, past experiences, and I think these are all things you know. Individual and age differences, varies, of course. Belief in personal relevance, escalation of commitment influence what choices people make. All of these are important. And why do I say that? Because if you're going to take action, as a leader, you have to have the idea, you have to have vision and goals. You're a leader, you want to go somewhere, you want to go somewhere. You're an agent of change, but you know, I'm assuming you know where you want to go. Okay? The challenge for you is two things. One, if you have a vision and goal, how do you get there? Two, how do you grab others and take them with you? And how do you do it in a burnt out environment? So you have to be able to effectively communicate that vision with others. You have to get the buy-in from people. Or else, I mean, you can force them to do it or you lose your job. That's not leadership. You have to provide the necessary knowledge, information, and ways or methods to realize that vision. You have to give them the tools to be able to understand. And then being able to manage conflicts, resolve problems, and overcome obstacles. So you have to be able to do that within yourself, but also within the group. You have to be able to do all of this. Some of the scenarios that physicians find themselves in as far as clinical leadership. Sorry. In the ER, if I'm running a code, if I walk in, first code I ever was in, I was an intern. I just moved from, I did my training in Philadelphia. First day on the job. I'm supposed to have 2 residents with me, or 2 interns and 1 resident. There's a code. I walk into the code. No, you know, it's the first time. And everybody, there's something we call a code captain. You identify yourself as the code captain. I was the only MD in the room, but I could have been but I was the least qualified person to run a code. There was the house supervisor, the resident hadn't made it yet, and everybody was doing CPR, and everybody turned around and looked at me like, okay, here comes the doctor. And all I could remember was epinephrine. That's it. Nothing. 2 days ago, I'm a student. Now I'm running a code. The life is in my hands. Are you kidding me? I did. Oh, epinephrine. And that was it. And needless to say, I did not convey confidence. So the person who helped me tremendously was the house supervisor. She was like intern, and it's July 2nd or what have you. So it's the second day or first day. Anyway, so she said, "Doctor, do you want us to do this?" Yes, yes, that sounds great. Do you want us to do that? Yes, yes. Until the resident walks in. It was a third-year resident. Resident walks in and says, "I'm the code captain." I could sense that everybody's like, all right, somebody finally who knows what to do. And he ran the code and it's fine. If I'm in the ER and I have a code and I walk in, it's like, oh my God, somebody's dying. And I start running around and my hair's on fire. Not going to work. So that's where I'm a leader. I'm a leader in the ER. You're a leader in your clinic. You're a leader in your interaction with your patient. You're in the OR. You're in the endoscopy suite. You are talking to fellow staff members. You're talking to other clinical staffs. You're doing rounds. You're in the OR. Wherever you are in the role of a leader. As a physician, that's your role. Now, from studies on anthropology and animals, they looked at, there's a herd of animals. You know, there's an alpha male and alpha female, and they're grazing. Do you know how many times on average the animals in the group would look up to the alpha male and alpha female to see if everything's okay before they continued grazing? How many times a minute? 17. Glance at the leader. The leader's calm, we're eating. Glance at the leader. Leader's calm, we're eating. That's how important the leader is. And you are the thermostat. On the executive part, you could be the CMO, the chief of staff, the chief of department, medical director, head of your clinic. This is the non-medical or clinical side, if you will. You could be writing laws and doing IT stuff. So here you are as a physician. So what happened? How did we transition from being clinicians to being executives, healthcare executives? All right. You are a clinician, then all of a sudden now you're supposed to be a chief medical officer. The problem with that is most programs and organizations make lies in the assumption that successful clinicians will make great leaders. One of the main problems in this approach is that physicians get promoted based on their clinical expertise and success into roles that require a totally different set of abilities, desires, and expertise. Some of these things we've already seen. You need emotional intelligence to be an executive. As physicians' lowest EQ, you're a great clinician, it means automatically you're going to be a great executive. Absolutely not. What that does, it creates problems with the physician himself or herself, and then with the staff. For every complex problem, there is a solution that is clear, simple, and wrong. So they realize, look, you know, doctors are not listening to us, or we can't get the message across. Let's hire one of them, make them a healthcare executive, and maybe they'll listen to him or her. The problem is that contributed to burnout. So here was the reality. You're a physician, you study medicine. ACGME competencies, you develop a patient-physician relationship, you create change into that relationship, hopefully for wellness and health in that patient. Wonderful. You are not taught as a physician to have societal, political, economical, and environmental factors effect on them, to be able to run a physician community, to do research, collaboration, and application among other entities, and to be a leader in healthcare, to be an entity for change. We're not taught that, yet we're expected to do that through ACGME competencies, which have nothing to do with being an executive leader. So the challenge now is, or was developed, okay, you know what? Maybe we need to teach some folks new leadership competencies, because obviously what they're doing is not working. They're getting burnt out, they're affecting everybody else. See, during the training, physicians emphasize their own individual performance, their own growth, they value their autonomy, and they have a difficult time seeing themselves as followers, with little value given to leaders within their own institution. They really don't care much about others as far as leaders. They experience extended subordination with long and hierarchical training, and most physician evaluations are based on individual performance, not team or group based. That metric for executives doesn't register with us because we don't know it. All our training is about interacting with the patient for the most part. Now, the newer trainings, yes, you have some skills. That's why this whole program was created. That's why you joined. Physicians usually extend their clinical authority as an extrapolated leadership into other facets of their lives and responsibilities that require a totally different set of skills. We sometimes do that. We think we're good here means we're going to be good over there. And we are trained to be deficit-based thinkers. What that entails is an ability to develop a differential diagnosis based on deficits so that they are better able to troubleshoot and find solutions. This hinders and impedes abilities to have an appreciative thinking approach to problems that better serve organizations. It's a totally different ballgame. So here's your physician mindset. He's an expert mindset. He's a doer. She works one-on-one in sequence. She values autonomy. They're conservative, reactive decision maker. Their success is measured by intrinsic results such as patient-physician relationship, problem solving, income generation. They have little or no business training or experience, and the results are demonstrated in patient quality care. That's the physician mindset. You're asking that mindset to lead a healthcare industry. Here's an executive leader mindset. They're planners, they're designers, they're organizers. They value collaboration, they're team players. Their success is surrogate measures such as financial benchmarks. They have formal education, and the results are demonstrated in outcomes and quantitative measures. Totally different skill set and mindset. So why do we need physician leaders anyway? We now know that there's better patient outcomes, decreased mortality, increased financial rewards for the organization when you have a trained physician in the executive role, decreased rates of burnout, healthier physician, and improved quality of care. So the key issue now, of course, enhanced patient safety, the key issue is how do we develop those physicians? So remember that, all of that, the effects on burnout, all the factors, let's flip it around a little bit. Let's put leadership. There isn't a part of that leadership does not impact. And here are some of the responsibilities of the healthcare executive. So we know what your responsibilities are towards the patient, but when you become healthcare executives, no matter your role, communication and relationship management, professionalism, business skill and knowledge of the healthcare environment. These are new set of skills, if you will, different than the ACGME competencies. You're going to have 4 challenges: complying with new government requirements and mandates, implementing value-based reimbursement, technology acquisition, investments and implementations, and then addressing rising pharmaceutical costs. So from the standpoint of the healthcare executive, they give the healthcare executive team said, okay, here's a lemon. I want you to go and make a lemonade. They make a lemonade. So wonderful, great, you're doing a wonderful job. High five, everybody. Now I want you to do 2 glasses of lemonade with the same lemon. All right, so let's look at the budget. Let's look at hiring. Let's start cutting things here and cutting costs there and forcing things down people's throat and increasing the EMR use. And we have to get paid per charts. So let's start sacrificing quality of care. We need quantity of care and so on and so forth. By some magical force, we do this. And the one that's providing the lemon isn't just a for-profit organization or what have you. It's the government, it's the institution, it's the policy, it's the public policy, and so on and so forth. So after hospitals manage to do this with you at the middle of it, because you're going to be the relay between the reason behind why these new policies are there and your physician group, they come back and say, all right, same lemon, 3 glasses of lemonade now. At this point, we're selling, whatever we have, doing things that we didn't think about doing, running ERs with 1 nurse per 5 patients instead of 1 per 4 or 1 per 6, cutting staff, doing things that jeopardize patient care, increase control, decrease autonomy for the physicians, having the physician herding cats. They have to do this, you have to do that, you have to do, we have a deadline. Because if you don't do that, the hospital will close. And by some magical way, you do it. Now they come and say, excellent. Now I want you to do it with a smaller lemon. That's the world of the healthcare executive. In one of the workshops we give, we change the narrative Ladies and gentlemen, in the blue corner, you have the physician, and in the red corner, you have the healthcare executives. They're going to go in and fight in the ring. The problem isn't that. Really, they're on the same team, they just don't know it. From a physician's standpoint, I'm truly concerned about the quality of care and the health of the patients. The executives are only concerned about profit, maximization, and cutting costs. They don't know the first thing about patient care. From the healthcare executive standpoint, I am truly concerned about the quality of care that is provided. Physicians are only concerned about how they get paid. They don't understand that there are limited resources available or what it takes to run a hospital. So in the workshop, we actually sat a group of healthcare executives, a group of physicians, said, all right, let's air it out. And once we went through a presentation of what the healthcare executive goes through and the physician goes through, they started talking. They realized, you know what, let's not forget it's you and me versus the problem, not you versus me. And the reason I say that is because whenever you're going to work, you're going to need the support of the C-suite. And part of your challenges, if you're going to create challenges in your institution, is to get them to listen to you. And you also need to understand that they are on your team. They just don't know it. You go back to that. So here's the leader of the group and everything we talked about. We know that the leadership competencies that I talked about, emotional intelligence, conflict management, decision-making skills, influence, self-care and wellness, and self-leadership. These are your leadership competencies that you need. We've talked about, some of them. But these are the ones, you got the ACGME competencies, now you have the leadership competencies. The challenges moving forward to implement these things are to be able to navigate the identity of physicians. Look, it's one thing we came in to help people, then we're molded into this being, and I told you some of the things that happen. How do you navigate that? If I am talking to you and I'm trying to convince you to change, I'm sitting here with you, giving me 5 hours of your time to talk about something that needs to be absorbed by you, understood, believed in. And that's 5 hours of conversation. How difficult do you think it's going to be to implement change on an institutional level? We have to start early, right? We said in medical school, yes. Influence their thought process. We have to change the way physicians think. We have to develop their leadership skills. If you don't know how to lead in an executive way, we know how to lead clinically eventually. I know how to run a code now, but I still don't know how to run a hospital. Understand the new landscape of the profession and business of medicine. That's on us. So it's already out there, but that's on us. That's on you. You're taking this course. When you're done with this course, you'll understand some of the nuances, some of the new challenges. You need to implement these. These are the challenges moving forward: prevent burnout, enhance self-care and wellness. Where do I begin with all of that? So, sorry. Where do we begin with all of that? Before you are a leader, success is all about growing yourself. Go back to the self-care, wellness. Success first comes with you. You have to learn how to lead yourself. Because if you can't, if you don't, you won't be able to do it. When you become a leader, success is all about growing others. That's where it needs to start. It needs to start with yourself. And what is self-leadership? The practice of intentionally influencing your thinking, feeling, and behaviors to achieve your objectives. Again, it's an active thing. You intentionally do something. And again, you intentionally do something when you believe in it and it doesn't go away. It doesn't have any fading. It has a staying power. The staying power comes from your intrinsic motivation to desire for change, influencing your thinking, cognitive, behavior, emotion. When you learn how to do that for yourself, then you can take it and start asking people to do the same thing. Exceptional leaders distinguish themselves because of superior self-leadership. Daniel Goleman, one of the fathers of emotional intelligence as far as the books he's written. At the individual level, studies consistently show that increased self-leadership corresponds with better effective responses and improved work performance. And if you go back to the fact that leadership is an act, and it goes with the desires, with what you believe in, with your culture, with your, what matters to you, then if you are able to master all of this and make sure that what you're doing means something to you, then you're going to be a great self-leadership. And we know also from neurophysiology, leadership of others starts with you and ends with them. Three great aspects of great leaders. One, create a safe environment. The brain works that much more and better when it understands that the environment is safe to operate in. Go back to the herd that's eating. Go back to burnout. Afford a safe environment. How do you afford a safe environment? You know what people need. You know what you need for a safe environment. Work on it. Demonstrate fairness and then be genuine and show trust in others. If the person in front of us is untrustworthy, we become the same way. Neural mirroring. So if you are burnt out, people are going to be burnt out. I hope you're starting to see more and more how everything is connected. Several programs have attempted to tackle the issue of physician leadership and training. 4 recurring pillars or abilities: leading the change, developing self and others, fostering teamwork, and demonstrating character and integrity. If you're able to do that, you're able to accomplish what you need. So some of the challenges right now, healthcare organizations are made up of many professional workforces and silos, making them complex structures to manage. Physicians' characteristics we talked about. Not enough time or opportunities during academic training, so they have to start late. And with all what that means, the presence of several urgent challenges with respect to quality, access, and affordability. So leadership training from within the organization, you have to manage the external environment, new technologies, and the difficulty of managing the professional workforce. All of these are challenges to create effective physician leaders. Again, here's your healthcare. Science, especially natural and medical science, is always undergoing evolution, and one can never hope to have said the last word upon any branch of it. Why do I say that? Because medicine now is different than medicine 100 years ago. Our schools now still graduate physicians as if they're going to practice in the William Osler era in the late 1800s. We haven't caught on yet. Morgan was saying in his morning, he tries to read up on things because he believes that medicine is behind the 8 ball as far as that's concerned. But we excel in one thing. For some reason, this has escaped us, but we excel in one thing. What is that? We are able to declare the past, diagnose the present, and foretell the future as part of being a physician. And if we do that, which we are trying to do now, we're going to not only tackle the issue of leadership, but excel in it. Again, I want you to raise your right hand, and I need you to take an oath. This will be the last oath. But I want you to raise your hand and say, I will become a red fish. I see lips moving. I'm going to take it as a yes. You're going to have to become leaders. When you leave this presentation, you go back to your world, nothing changed out there. And you're going to have to change. And funny thing happens, if you've ever been in a crowd, you're standing in line and somebody walks in another direction, like, I wonder where they're going. Maybe there's a short, maybe they know something I don't. And then slowly people start following, especially if they see the results. Like, oh, you know, whatever you're doing, I want some of that. Okay. And knowing is not enough, we must apply. Willing is not enough, we must do. And if you go back to the steps, the secrets of successful wellness, I said, decide, make it a must. Which brings me to my 4th video. You ever heard of Anthony Robbins? If you have not heard of Anthony Robbins, I see Olga shaking her head. He is only one of the greatest motivational speakers, coaches on the planet. I had the pleasure of going to see one of his workshops. It was a 5-day workshop in Las Vegas. We were only 900 or 1,000. He has workshops where there are 20,000 people in the room. We started at 9 o'clock in the morning. We finished at 1 o'clock in the morning, the first day. He gave us a break, 15 minutes. That's it. That's how intense this person is. I'm going to show you a clip about musts. The volume on this one is a little bit low. I apologize.
The number one thing that's going to change your life, the only thing that will change your life, change your business, change your money, change your relationship, is you must raise your standard. Now, I know that sounds boring, stupid, basic, but it's the truth. The only thing that changes our life long term is when we raise our standards. What does that mean? That sounds so boring and dumb. It means that all of us in life have things we want. We don't get what we want. We get what we have to have. Remember I said earlier, we all get what we tolerate in ourselves and other people. But when you're no longer willing to tolerate something, that's when your life changes. The difference in people is their standards, period. The difference in people is their standards, period. And what do I mean by standards? Everyone in the world has a list of things they think they should do. I should lose weight. I should work out. I should spend more time with my kids. I should work harder. I should make more calls. I should. And then you know what? People don't do their shoulds and they get mad at themselves and they what I call should all over themselves. They beat themselves up about it. What changes people is when your should becomes a must. When suddenly the thing you said should happen has to happen. That's when human beings change. It's like if you want to take the island and you're the head of the army and you want to take the island, the most powerful way to take the island is burn the boats. Because if there's no way to go back, it's amazing what happens when it's a must to do something versus a should. That's what makes human beings succeed.
And from the words of someone who actually has done it, you must expect great things of yourself before you can do them. And that goes back to the mindset. Okay. That's the spiel about leadership and its tying to burnout and why it's happening and how we can help it. Any questions so far before we jump into the coaching part and hopefully have you out of here earlier? Okay. How many of you know what coaching is? I'm not talking about Phil Jackson and Michael Jordan kind of coaching. Okay. You would agree with me that our landscape is shifting, right? We thought we knew what we were doing, and this is before COVID. Then burnout hit before COVID, and it was like, I don't know what we're doing. We don't even know that there's a problem. Then COVID hit, and here's where we're at. So we have not yet fully figured out how to deal with the prior landscape of burnout. We haven't. We're learning. Our current landscape keeps changing. How do we maintain our balance? That's the challenge. How do we maintain our balance? How do we successfully navigate it? And how do we lead others and make sure they do not fall? We need to look ahead, right? Without stumbling in the now. We need to foretell the future. How do we do that? What do we need and why? What will the road look like later? Will it ever be smooth and somewhat predictable again? What will be the new norm? If we learned one thing over the past year, that there's no predictability. There's a saying, you know, when a man plans, God laughs. There's a reason. From Marshall Goldsmith, what got you here won't get you there. And it's pretty obvious that I've been telling you for the past 3 or 4 hours that the whole system of our training needs to change, but at the same time, where you are in your life is not going to afford you the best possible ways to be where you need to go, given everything. So the challenge is we have to learn new and different knowledge, tools, skills, and practices. And I think we made the point for that so far. Now let's go back to that experience of change. So I told you all of this is about change. Let me zoom in a little bit on change. You have point A. Point A is somebody's burned out. Point A, you've got a patient with a disease. Point A is any place. Point A is you're here, you want to go to the bathroom. Point A is where you're at, you want to go to point B. All of life is about change. As a matter of fact, you know, and the body doesn't like anything being stagnant. It's always moving. Death is pretty much there's no more change. And whatever the point A is, situation analysis, identification. Where are you at as far as, look, if I want to change, or if the patient is sick, they're obese, they have high blood pressure, what have you. You have a goal that you need to reach, which is one of the exercises that I asked you to do. What's the behavior? Kind of like what Steve talked to us about. So the challenge now is, okay, here's where we're at, here's where we need to be. How do we get there? You ever tell your patients, look, so I'll take, for example, the psychiatry standpoint. You have a patient, they come in, you give them a diagnosis, like, here's your medications, you tell them why they need to take the medicine, and they just follow up, start this medicine, take X, once a day, take B twice a day, and I'll see you in a month, and we'll see. I'm just giving you a generic example of what happened. Okay. Patient comes back, they're like, I'm sorry, I didn't take my medicine. Sometimes they don't know what to say. I didn't take my medicine. Well, how do you expect to get better if you don't take your medicine? And I'm like, why didn't you take your medicine? And I may say, all right, I can't afford it. You've had that conversation before with some of your patients. I can't afford the medicine. I went to fill the medicine. They didn't have it at the pharmacy. I said, I'll wait. Somebody suggested a different medication, something. So they have challenges. Your New Year's resolution, why didn't you fulfill your New Year's resolution? You have challenges. We all have challenges. And we also agree that if we don't change anything, nothing will change. Okay, great. Change, change, change. Again, the issue is how. And I gave them the example of that patient for a reason. Again, like I told you from the beginning, I have ulterior motives. I also told you from the beginning that one of the quotes that I use every day for all my, for everybody, is what Theodore Roosevelt said. Now, if you're able, it's a simple quote. Do what you can with what you have where you are. That's what he told his military. They're off to go to war. Simple, right? So my challenge for you is the following. And if you are able to answer these questions, then you are enlightened beyond any human being that I know. So if you have a paper and a pen now or later, I want you to answer 3 questions. Right? Here's the first one. What can you really do? I'm telling you, do what you can. What can you really do? With what you have, what do you really have? Where you are, where are you in your life? Now, these are simple questions, like no matter what. I'm at the grocery store, I have to go to the pharmacy, do what I can with what I have and where I am. Okay, that's easy. But we're asking for something much, much, much deeper. Isn't it amazing that we ask patients and ourselves to do things that are life-altering, but we don't even answer these questions? If you go back to emotional intelligence, it'll be able to tell you to understand yourself and manage yourself. Go back to the exercise, to the walk, to the running, to the weights. These things apply to everything we do in our life, but no more than when you want to create a life change. If you're able to answer these questions, like I said, on a life level, a deep level, you are enlightened. Most of us don't know. Most of us go through life trying to figure things out, if we're lucky. So from the medical standpoint, here's the doctor, you give the patient the diagnosis, you say, hey, here's what's wrong with you. That's where we're starting. You're obese, you have high blood pressure, high cholesterol. We need to get you to point B where you have to lower your weight, reduce your blood pressure, reduce your cholesterol. And this is the goal, the outcome. And if you don't do that, then you're going to die. So I'm going to give you these things to do and go ahead and do them. The patient leaves like, but how? The doctor doesn't know that I work 3 jobs. I can't afford the medicine. I don't know how to lose weight. I don't know what exercise is good enough, and I don't know when to start, when to stop. I don't know how to manage my finances. I don't know how to manage my family. I don't know how to manage my life so that I am able to do what this doctor is telling me to do, or else I'm going to die. I know the problem. I just don't know how. Here are your goals. This is all about change. You have goals after this presentation. Your goal is to have your hands free so you can do whatever you want to reach your goal. The problem is you need your hands free to do that. But the reality is your hands are tied, right? That's your reality. That's the institution. That's the world out there. How do you deal with that? Untie your hands and so you are able to reach the goals. How? If we go back to that, this is the beauty of coaching. If you're able to answer the question on to be able to situation analysis and identification, like where are you in your life and what can you do and where what do you have? You're also able to find out exactly where you want to be. You know where you want to go. I know I need to do this. I know I need to be able to do that. I know I need to protect myself and lead others and so on and so forth. To help you answer those questions specifically and to help you answer the how do you get there with what you have, where you are, and what you can do, enter the coach. And remember when I told you, talking to Tina, I kept asking her until she came up with, maybe I should ask the patient if I'm connected. That's a very simple example. Tina presented a problem is we can't connect to our patients, we don't have time. What would you like Tina to do? I'd like to be able to connect with my patient. Okay, how can we do that? What do you have? I only have 15 minutes. Okay, what can you do? How can you do it? And voila, Tina came up with the answer. And that's the beauty of coaching. You come up with the answers. And I laughed because when Stephen was saying, I don't know how to bypass that issue, Tina jumped in and said, maybe you should schedule it. So Tina now was giving advice. She was giving a thought, which is what we do as physicians. And she was trying to be helpful. And I think, not just you, Tina, all of us were trying to think of a solution for Stephen, yes? All of us wanted to suggest something for Stephen. Please say yes, because I know everybody wanted to say something to Stephen, like, yes, have you tried this? Did you do that? So the coaching part is you come up with a solution. And when you do, you own it. It's yours. You can't reach the destination which you don't know. So what's the use of hard work if you don't know where it is taking you? So now, coaching is a growth promoting relationship with the client patient. And that with the following at its core. 1, you develop clear vision. 2, you understand your abilities. 3, you achieve achievable goal settings. You nourish internal motivation and you enhance the capacity to change. That's what coaching is. Now I'm going to tell you that in the medical world, coaching is gaining traction. Now there are some clinics that have coaches where the doctor talks to the patient. They say, here are your goals. This is what you need to do. Now go talk to the coach so you can see how to get there. And the coach is the one that spends time trying to elicit the response from the patient. Now, this is where I told you all of this is data driven. And I told you there's one part where it's my own personal opinion. This is it. I believe the future of medicine, whether it's fighting burnout or helping physicians and patients, is coaching. That is my belief. It's not counseling and it's not therapy. Obviously, you see the difference. A coach is responsible to help the client discover, clarify, and align with what the client wants to achieve. You help them discover. You encourage client self-discovery. You elicit collaborative and client-generated solutions and strategies. You push it back onto the client. Say, all right, what do you think? How can you come up with something? And that's what I did. I kept pushing Tina, not pushing, but I kept asking Tina and you guys until you started to think about it. Well, maybe if I do this, maybe if I do that. And then you hold the client responsible and accountable. It's 6 things, if you will. It's more than that, but I'm summing it up. It's listening, not talking. It's asking, not telling. It's reflecting, not commenting. There's no advising or counseling. It's being collaborative and do not give answers. Always allow for self-discovery. That's coaching, which is the exact opposite almost of medicine as a physician. Now, 12th, we can do, let me skip through that and take you to something that I think summarizes it a little bit nicer. Here we go. Coaching being a physician is like apples and oranges. Why do I say that? The expert approach as a physician, you deal with authority. You are an educator. You define the agenda. You feel responsible for your client's health. You solve their problems. You focus on what's wrong. You have the answers. You interrupt if off topic. You work harder than the client. Then you wrestle with the client. That's the expert approach. That's us. Coach's approach. You're a partner. You're not the authority. You are a facilitator of change. You elicit the client's agenda, not yours. The client is responsible for their health. You foster possibilities. Sorry about the background noise. You focus on what's right. You go discover the answers. You learn from the client's story. The client works as hard as coach and more, and you dance with the client. You see the big difference? It's a shift or a difference as big as between the difference between physician and executive. And our mind is set for that part, so it's very difficult to become a coach. Now, when we train physicians to be coaches, they go through the agony of growth or change, not growth, change from that mindset to this mindset. And I say agony because they are itching to give solutions, especially when they're coaching each other. Like, I think this will help. And coaching integrates multiple scientific disciplines. It's based on theories of self-determination, positive psychology, appreciative inquiry. And appreciative inquiry is you find out what's right and you do more of it, as opposed to find out what's wrong and doing less of it. Emotional intelligence, social cognitive theory, constructive development, all of that. The mechanisms of coaching, it's a growth promoting relationship. Clients are not broken and need to be fixed. They shift the focus from what is wrong to what is right. They help clients find out what they really want. Help clients chip away at whatever is blocking them from achieving their goals. The value is in the growing process more than the expert opinion of coaches. And help in achieving goals through neuroplasticity. You have to change your mindset, the way you think, intrinsic motivation, everything that I have been trying to say. Number two, elicit self-motivation. External motivation is not the fuel. We talked about that. It's internal or autonomous motivation that you need. You connect to behavior, that's the connecting behavior to something in the future that we value. It's future-oriented and desired identity-oriented, or identity-oriented, autonomous motivation. It's the kind of motivation that we need to fulfill or get the change we want. When the act is done for the reward of its own self, this provides the greatest motivation. 3, build confidence. It's equally important to build confidence and capacity to sustain motivation. You help them do that. This occurs with effort over time. Coaches try to help clients identify and achieve goals that will build confidence. And what does building confidence do? Help with resilience. A little success improves motivation and confidence and resilience, and then enhance positive emotions. And then you increase somebody's competence. So once they start knowing that they can do certain things, they start believing in themselves, they start doing more, and so on and so forth. And last, it's a process of change. Clients will benefit from structured processes and projects. They just want to say, oh, I want to do everything. That doesn't work. They have to have SMART goals, specific, measurable, actionable, realistic, and time-bound, much like for yourselves. If you set yourself with a SMART goal, you can self-leader yourself into that SMART goal and talk yourself into how and why and what and where. And once you achieve that goal, you have success. There's accountability. There's a regular progress report for you, for your coach, for your patient, for the client, setting milestones and support from other professionals. And why do I say that? Why is it important? So these are some of the outcomes from coaching: increased self-awareness and self-knowledge. As I read them, I'm going to pause for a second. As I read them, if all of this is about change, this is what needs to happen with you first and then with others. You have to have increased self-awareness and self-knowledge, increased personal responsibility. You have to have acquisition of new knowledge and skills to be able to do that. Attainment of personal and professional goals. You have to be able to get to those goals. You have to have sustainable behavioral change. And this is what coaches help you to do. Increased life satisfaction because you've done it. Increased self-efficacy. I'm more efficacious in doing it. Developed sense of purpose and meaning. And becoming one's best self. If I'm able to help you with all of that and you're tying it back to purpose and need, You become your own best self. Some of the things that the literature talks about: life coaching improves self-efficacy. We talked about health coaching is essential for changes in health-related behavior. It works whether you're remote, like Zoom or phone, or not, and it works in groups. This is what we know. We know that the major targeted points include stress management, positive enhancement, and role of meaning in life and higher purpose. Most people lack the confidence, stamina, purpose, and focus to lead a healthy life. That applies to you. That applies to me. When I say people, you're probably thinking about patients. Let me remove people. Most physicians lack the confidence, stamina, purpose, and focus to lead a non-burnt out life. Most people want to live and be well, and most people wish they were in control of their health. But there's a need to develop new life skills, is what we call them. The expert approach is becoming obsolete in telling people what they need to do. Sometimes we have to, but for the most part, if we want the change, that's not going to work. Healthcare is not a one glove fits all, and we all know that. So if we're going to individualize it, why do we give cookie cutter advice when everybody's an individual? Physicians and the medical society are not equipped nor prepared for the nature of healthcare. If you take a step back again and you let everything we talked about today sink in, you'll probably think it's a tremendous thing to undertake. But then the more you do it, the easier it gets. And you probably will also notice that you have to learn things. You have to learn new things to be able to do that. In the future of health and wellness coaching, where are we going from here? Research into this relationship has shown promise in the ways healthcare need to change, and we're at the infancy stage, if you will. In business world, they are much, much more advanced. Initially, it started off with you need a coach, it's a taboo. Now you need a coach, you must be very important. The focus is on encouraging accountability, like I said. The shift is towards a client-patient-centered approach. And how many physicians have time to do that or know how to do that? We don't. And so that's one of them, again, the challenges of the 21st century physician. The shift is towards self-discovery and active learning processes. And you hand some of that responsibility over to your patients. Like I said, infancy stage. It's an ongoing process. And there are new discoveries and pathways that we still need to implement, because what happens and what works in the business world doesn't necessarily work in the medical world. So here you are. The last few slides are going to be a summation of everything we talked about. You've got the patient or the client that need to change from point A to point B. The old approach, physicians, we solve acute problems, we're the expert model, that is a failure, chronic failure, or else we wouldn't be trying to change it. The reality is people don't have acute problems, so they also have chronic diseases. The healthcare concerns, there's life and wellness goals. That's the reality. So how are we able to do that is the challenge, to help people manage their chronic diseases. Coaches help identify achievable goals. Great, we talked about that. They answer how, and do what you can with what you have where you are. Wonderful. There's intrinsic motivation, there's stamina, there's confidence, there's focus. We need all of that. Most people, most physicians lack that. Coach helps you with all of that. And then helps with the patient autonomy and developing life skills. These are all the things we need to actually deal with the ailments that we have. If we're able to implement that, and because we're able to integrate multiple disciplines, I'm going to tell you that we're going to obey the law that it's not a one glove fits all, and we'll be able to tackle the problem in a much different yet needed way. And this applies to burnout. Does that make sense so far? Okay. So if you want something you've never had, you must be willing to do something you've never done. And most physicians have never done what we have talked about. Looking into the future, because that's what we do, every human being is the author of his own health or disease. What if we remove that and say own success or failure? We have the ability to do that. Coaching is releasing a person's potential to maximize their own performance. It is helping them to learn rather than teaching them. Lawson in 2013. We must promote health coaching's practices and its principles as both an example and a force for change within a system of healthcare that is struggling to create greater accessibility, effectiveness, and sustainability. And again, I used his quote, not because they only found it in 2013, but because it's been echoed, and he says it beautifully. We've covered multiple concepts here. So let me review them real quick with you. We started off with, this is a presentation about change. To have change, we tied it to intrinsic motivation. And we talked about the importance of purpose and need, which ties into the intrinsic motivation, which will always answer the question, why am I doing this? When we do that, we hope to tackle burnout and not only survive, but thrive. It is a challenge, and we saw the magnitude of that challenge. And that challenge is to tie all of this together and continuously do so. Now, how are we going to approach that, and what are we going to do? If we don't change our mindset, we're not going to be able to do any of that. So we're all in agreement now that we're going to stand up and face the grizzly bear that's attacking no matter what. The best ways and tools that we have go through our emotional intelligence, self-care and wellness, and leadership. If we're able to master those and harness the power of all of these with the right mindset, we're able to meet those challenges. And if we're able to do that and maximize it through either coaching, whether you want that or not, we're going to be able to impact the following: our prefrontal cortex. So, does this make sense? Does it summarize everything we talked about so far? Okay. Now, I told you it's all about your prefrontal cortex. Let's not talk about the hippocampus because it's part of the picture, but I didn't want it, but I can't do anything about it. The ACC, the anterior cingulate cortex, is a part of our brain that's responsible for being creative and finding solutions. Apparently, it's also dampened by burnout and negative moods and emotions. And I already talked about the amygdala. So the prefrontal cortex, cognitive abilities, self-control, emotional intelligence, IQ, and the physician interaction with the patient satisfaction lives in that part of our brain. It is also how we choose to respond to stress, our mindset. Wonderful. Amygdala, we talked about that, the hijack. You lose IQ points. You can lose up to 15 IQ points if you are hijacked. And you make more mistakes. The ACC, problem solving and creativity. Now, what we have learned, and we talked about how the prefrontal cortex controls the amygdala. Stress, burnout factors, training, practice of medicine shrinks your prefrontal cortex, loses connections. If this is lost, these are lost. So that has a negative impact. Negative emotions and mood. Remember, burnout is contagious. That negatively impacts this. As physicians, we need to be able to problem solve and be creative. So between these two, the two important parts of our brain are being assaulted and shrunk. With mindfulness, and we know that mindfulness, 5 to 7 minutes of mindfulness and meditation increases your prefrontal cortex, increases your connections. This is seen through neurophysiology, neuroimaging. With wellness, with EI training, and with coaching, with reconnection to purpose and need in medicine, our prefrontal cortex grows back again. And if we are able to maximize the positive triggers and minimize the negative ones, and we are engaged and happy and satisfied, we increase or enhance our ACC. Really a simple formula. Now, also the challenge moving forward is how do we deal with those institutional changes and outside factors, which we touched upon initially. And we know that if we enhance these things, making them more conducive to our work, then they impact stress and burnout when we are less burnt out. So our challenge is also taking from what we learned today and applying it on an institutional level. And the key to change is micro initiative. We call micro initiative, but macro success. And so let me tell you, so all of the examples that I gave you are small micro initiatives that you can start with, baby steps, and then you become more masterful, and then your steps become bigger. Which brings us to the issue of momentum. Once you start the change, you develop momentum. According to Michael McQueen, I love this formula. Momentum is focus plus action times consistency. What do most physicians lack? Focus, action, direction, and consistency. When you develop that momentum, the change happens, and then you lead others through that change. Okay, what's next? Where do you go from here? What happens when you close that laptop or computer? Identify first, the AAA, awareness. Okay, now I know what are symptoms and signs, and I understand pathophysiology. Second, assessment and acknowledgement. Your burnout, your abilities, your assets, your limitations. Identify. Mindset. Decide not only that you should change, but that you must and will change. And some of these identifications include tests like the EQ, the Maslach Burnout Inventory, the resilience questionnaires. Enhance, work on your EQ, self-care, self-resilience, self-leadership. Plan, with or without a coach. Outline a plan of action that's for you based on your own parameters, but you know your goals, you know where you want to go. And in the words of one wonderful master, adapt what is useful, reject what is useless, and add what is specifically your own. I told you I'm going to give you a little bit of tips on the institutional level. Here's what it looks like. Identify a champion. Like I said, now they are creating a new post. It's called Chief Wellness Officer, CWO. Because they figured out first they tried to give it to the CMO, then they gave it to the human resources, then they gave it to quality control, and they figured out, you know what, none of these people know the whole story. So we have to have someone just trained to be a chief wellness officer. And there's a whole industry on worksite wellness. It so happens that now it's touching the medical field. Identify a champion. If you want to take charge, go ahead and say, I'm the code captain. I'm the wellness officer. I will take charge. Involve everybody. Residents, faculty, program directors, management, involve everybody. Identify the needs. Do a survey. What can you fix if you don't know what you're fixing? What do people need? Know your questions. Know what to ask. If you know most of the things that cause burnout, you know what questions to ask. I used to have an attending that says the single most determinant factor in asking the proper questions about history is your knowledge of what you're looking for. If you don't know what you're looking for, you're not going to ask those questions. Outline your goals. Then develop an action plan, immeasurable, SMART goals. Identify your resources. What can I use? Do I have an empty room? Can I put a gym in there? Can I have a place where we can sit and talk? Assess and reevaluate. Set a timeline. Okay, what happens in 3 months, 6 months? Oh, is it working? Is it not working? Fine tune and commit. Involve management, like I told you. C-suite is necessary. Go back to our initial why are we here and primal sympathy and so on and so forth. Let's tie it all the way back to primal sympathy and intrinsic motivation. In a battle, all you need to make you fight is a little hot blood and the knowledge that it's more dangerous to lose than to win. I hope I have convinced you that we cannot quit fighting, and if we quit fighting, the outcomes are very, very dangerous. We talked about suicide and all the impact. We talked about us, what happens to us, and then the impact on the patients. Simply stated, we cannot afford to lose, and we won't. And we can't afford to stop fighting, and we won't. No matter how great the talent or effort, some things just take time. You can't produce a baby in 1 month by getting 9 women pregnant. That's from Warren Buffett. Some things take time. There's no shortcuts. It takes about 14 to 180 days to anchor a habit. Remember, I said one of the things about wellness is you have to create a habit. That's the 4th step. Medicine is only for those who cannot imagine doing anything else. That's why when you folks ask you, how can you do it? Now you know why. Can't do anything else. I can't imagine myself not helping people. To know even one life has breathed easier because you have lived, this is to have succeeded. That's us. That's you. If you impact one life in a positive way, it means you have succeeded. Our demands are not high, folks. They're very, very, very honorable. sacred. And from Nietzsche, he who has a why to live for can bear almost any how. Never forget your purpose. Fight for your need. Never forget your purpose. And if you treat people as if they were what they ought to be, you help them become what they are capable of becoming. Meaning, if I'm allowed to help you become physicians, you're going to be engaged. You don't need anything else. Now, anybody intrigued by our friend who kept interrupting? I'll take suggestions on what this person is doing. All of you can unmute. Let's have a full-on conversation. Let's just unmute and think out loud. What is he doing?
Digging.
Digging. Obvious, right?
A well.
Well, let me say that he's digging a very deep hole, correct?
Yeah.
Digging a hole for himself and getting himself in more trouble.
Who said that? Jordan?
I did, yeah.
So let's take a look, for instance. Who decides one day, I'm going to wake up and dig a 20-foot hole? People don't do that. Now let's think about it for a second. What does it take to dig this hole?
Purpose.
Purpose. It better be, whatever's down there, it better be worth it. Right? What else does it take? What does he have with him?
Shovel.
Shovel. Shovel. He's only using a shovel, right? So he must be doing something repetitively to dig this hole. He's moving, right? So obviously this hole is a change in the landscape. Maybe a week ago there was no hole, now there's a hole. And so he's doing something, a repetitive motion with one tool for a reason that's pretty strong enough to get him down there. Does that sound familiar to any and all of you? I asked you to change. You have to have purpose. You have to have momentum. You have to be consistent. You have to take action. You have to be focused to get to where you want to go. Real change is not an event. Change requires repetition. And whatever you decide on, that's what it's going to need. Please don't go out and dig holes in your yards. That's not the, but oh, this is what we learned from our module today. Excellence is never an accident. It is the result of high intention, sincere effort, intelligent direction, skillful execution, and the vision to see the obstacles as opportunities. And I think with that, I'm going to say thank you. And I'm going to open up. I'm going to stop sharing. And I know we have till 3. Of course, we're going to leave before that. But at this moment, I would like questions, feedbacks, thoughts, what you started with, your own expectations, what you ended up with. Just give us feedbacks, everybody, talk to each other. Let's see. Now, when you're going to get an evaluation form, I would please have you fill out to the max so that I learn from, that's my way of learning, is if nobody tells me if I'm doing a lousy job or a good job, or I want you to stress here, less there, I wouldn't know. So I'd appreciate that. So let's start. Tina, you're on my top left corner.
I feel motivated actually to change some things, to turn my shoulds into must that have been sitting there. So trying to make a plan. It suits my personality a little bit to kind of think through things and try and get a plan. I sort of put it on the back burner with residency, feeling like I'm too busy, but I sort of see how it integrates and can make a difference, you know, where you're at. It's like you say, do what you can with where you are and what you have, instead of like, I kind of push stuff to, oh, well, when I have more time, then I'm gonna change. And this has made me rethink that a little bit.
Wonderful. Olga, you're next on my screen.
Yeah, well, I initially, it's kind of a retrospective kind of enlightenment for me, because I think I went into anesthesia with one goal and I came out going into a different field because of said experiences within anesthesia. So it was interesting to see in effect that essentially it was a burnout. I think that caused me to switch gears into a field with minimal anesthesia. And one of the things that was that patient connection that I think we all, like you said, grow into, the altruistic medical student. And then by the time it's been drilled out of you, you realize, man, there's no like positive reinforcement for this anymore. Why? So I think that's one of the things I really learned. Like, oh wow, there's my big light bulb. It's like, aha, this is mainly one of the reasons why I am getting out of that field and switching gears.
Well, that's wonderful to hear. Thank you. Omatola, you're probably going to give us a different perspective. You're a practicing neurologist, so how did it give us your
I have to tell you, I have been a big cynic about burnout. I came today thinking, yeah, what else is he going to tell me? They always blame the person who's going through the problems, whatever. We have had attempts at a departmental level to attack burnout. And I've always come out from those sessions feeling more irritated than ever. And I struggled with burnout and probably, will continue to struggle with burnout to some degree. So to me, you had a big job to do today, basically to maybe help me to move beyond the cynicism that I've had, that I have for this field of burnout, or this study of burnout and what can be done for burnout. So I think you've actually managed to do that. I'm surprised. So if I could just say that. And the reason that I think you've done that is because you focused on starting exactly where you are. And if you can change your mindset and have some small goals, and then be the sort of the focus for change and sort of the focus for leadership in whatever small way, that could be a really small thing, like, I don't know, a daily huddle with your MAs. You got one MA or two MAs or a tech on an MA or whatever. And you guys, okay, how do we make this day better? How do we, whatever that is, I think that attitude makes a big difference. And if we're all coming to it as learners and have a collaborative approach, I think that could really make a difference. And that's the leadership part, right? So, and it's the leadership part that then begins to be the kernel for change at a bigger level. So I've always, the reason that I've been cynical about this whole area is that no one has ever really connected the dots from the changes you make as an individual to how that impacts the organization. And I've always felt that if you don't change the organization, what's the point? I could be as happy as heck. And then I come into the organization, and if everything's still the same, that will continue to sort of bring you down, the individual down. So anyway, I mean, I could go on about this, and my story is sort of interesting too, but for me, that was the kernel. The kernel was the connection between the change that you make as an individual. How do you connect to these key pieces? And then by doing that, become the leader that will sort of promulgate change in your in your little cubicle, in your department, whatever, right? So, and if we can all go forth with that in mind, I think that'll make a big difference, because if you're a good leader and you can give people the essentially the freedom to make the changes that are important to them, we don't all have to have a, 8 to 4 schedule. If for some specific person, they want to come in at 7:30 and leave at 3:30, if they accomplish the same goals, but they're happier doing that schedule, let them do that. So these are some of the things you can do as a leader to improve the control that people have over their lives, and potentially to reduce burnout. So anyway, long-winded, but that's, so thank you.
Thank you, Omatola. I'm going to hold you to the fact you're going to be a redfish. Thank you. That's wonderful to hear. Thank you. Jordan, you're next on my list of folks.
So I don't know what my expectations were really coming into today. I think that, like, we talk about burnout a lot, and you get a lot of lectures. I think it's a ACGME requirement. So, you know, it's usually not a it's usually not a lecture that residents are looking forward to. It seems kind of trite. And they talk a lot about like resiliency and ways for you to combat burnout. And so I thought this lecture was, I thought today was good in that it kind of took a different perspective. You know, we looked at it kind of from a systems perspective and talked about kind of what results in burnout and how system changes and physician changes and physician leadership and different aspects of those can make a difference. So I thought that was a good new perspective that I didn't have before.
Thanks. Christina.
Yeah, I think my expectation with these talks usually is I'm going to hear all the things that I'm doing wrong or that I know I should be doing, but I'm not doing, and I already know about them, so I don't always necessarily need you to tell me. But I think it was helpful that we like used an example like exercise more and worked through how we're going to make those changes as opposed to just saying we need to make this change. I thought that was helpful. And then also kind of changed my perspective. I don't need to overhaul my whole lifestyle to practice wellness, like doing small things every day and just kind of chipping away repetitively. It'll just improve over time.
Okay, wonderful. Morgan.
I guess I'll kind of go against the grain a little bit. Burnout is definitely not one of my favorite topics. And I think part of it has to do with kind of the corporatization of it, I guess. And the same with wellness. Like those terms, typically when I hear that, like others have mentioned, it kind of turns me off from the lecture. But I would say for me, I guess a counterpoint I would make is physicians, typically we are too scared to just walk away from something. Like if we aren't in a good situation, a good work environment, we try to compensate. And one thing that always kind of worries me about burnout and wellness is it something that will convince us to stay in an unhealthy situation where it may just be better to walk away and look for greener pastures? And that's something I personally learned this year, is that I need to think outside the box a little bit more. Like I don't have to have a 9-to-5. I don't have to work for an academic institution. I can actually take my skills as a physician somewhere else where I'll have more freedom, more autonomy. And it's okay to actually take a big risk and just change it completely. You don't really have to stay in the status quo. So I think for me, I just, one thing I learned is that I don't want to, because I feel like I'm very resilient, and that's part of why I've been able to get through the training. But for me also, that resiliency can be used against you. It can be used to convince you to stay in a situation where you probably would just do much better somewhere else. And so I think that's kind of the counterpoint I would make.
And that's part, thank you. And that's part of knowing yourself and managing yourself. And to your point, there are two thought processes. One thought process is like, stop asking physicians to be more resilient. If we were not resilient, we wouldn't be here. Correct. But at the same time, that's our environment. And we have to create new ways to be resilient. And one of those resilience is knowing that serenity prayer. I don't want to be here, and I'm going to go seek greener pastures. And that takes, you know how much guts that takes to say? How much courage that takes to say? For someone to be able to say, hey, you know what, this is not for me, and possibly deal with the stigma, or they couldn't cut it, whatever. Wonderfully said. I gave this presentation once, and at the end of the presentation, I had one of the chief radiologists. He was there, and he said he came in, he was trying to hire a new radiologist. There are 4 in the group, there used to be 5. And he was upset that that new radiologist says, who the heck does he think he is? He wants to work 4 days a week. He wants to do it, 8 to whatever, and then take off on Friday. Who does he think he is? He can take off on Friday. By the time I was done, he said, you know what? Maybe that physician is smarter than all of us, because he knows what he wants. And that's what works for him. And that's how he maintains his sanity. And good for him, because he had the guts to say it. Same thing goes with you. So yes, wonderfully said. Thank you. Sapna, you're next.
So I think a lot of good points were brought up, but one thing in particular, I think, as someone that has gone through the different phases of training and now am nearing the, the completion of training finally. I think something that you mentioned about it being periods, fluctuations of burnout, which you really do see as you go through training, because one rotation that you'll be on will feel fine, you don't really feel the stresses of medicine. And then suddenly you're in another rotation for a month and suddenly you just feel so burnt out. And, you feel that, well, it's just a month. I just need to get through it. And so you don't really commit to making any sort of a change. But because the frequency of those cycles where you feel burnt out, they're really, frequent. I would say in internal medicine, probably 50% of the year consists of those types of rotations. It's easy to put it off and not actually incorporate any type of wellness or any type of change that would really benefit. And so, doing small changes, sticking with them, like you said, making it repetitive, I think helps, but also realizing that these fluctuations can be a little deceptive because, chronically, you're still feeling the effects of the burnout. And maybe it only catches up to you when you're in fellowship. For instance, these past 2 years, I've thought, man, I am tired. It will be nice to take a break before I start life as an attending. And then I think now transitioning into attending life is going to come with a whole new set of challenges where you just about feel like you're coping, with all of these changes and training. And now you have to get a feel of what your new role is and how to manage those new types of burnout, the financial side, keeping up if you go into private practice, those challenges. There's, so many different things. So I think it's a constant learning curve and figuring out what burnout is to you and how you can deal with it. I think it's so different for each individual person, and finding something within your personal life that you can anchor onto.
Steve, you are my last participant.
Okay, yeah, I feel like I've gained insight into burnout, and I think I also reinforced my desire to make some changes in my life. So I feel like it was beneficial, this course.
Well, I'm glad. I really am.
By the way, Steve, it's okay if you don't jog. Just take more long walks. Sorry, I couldn't help myself there.
I know you were itching to. I need to tell them that. It's okay. I want to thank you all. Every time I learn a lot from the class, and yes, it's always it's a difficult class to sell as far as getting the buy-in. And if you thought and I want you to, if you understand now how difficult it is for you, and this is going through pathophysiology. I mean, we approach this in a way that, okay, you could be able to connect all the dots. Now you go back to something Omatola said, or you guys said, oh, it's another burnout lecture or another this, and great, thank you for telling me that I need to sleep more. I appreciate that. Okay, I hear it from my brain every day. Take that into perspective when you want others around you to change. And I am hopeful that, we need you. The medical field needs you. We do. We need you to change. We need to save medicine from itself. And we will change the institutions. We will. When I knocked on people's doors in 2014 and 15, I could tell you how fast the doors closed. Things are changed now. And it's like pulling tusks, not teeth. But I'm here to tell you it's very different. There's hope. People are responding to change. They're asking for it on a higher level. And what a way, it's a wonderful place to be in. And I wish you all the best. My information is there. If you have any questions, I'm available from now till I pass away. If you have any questions at any time in your career, email, call, text. I have a question, I have something. I'll be more than happy to to discuss, call, listen, whatever you need. Thank you.
I had a question about the coaching model before we
Yes.
we leave. Is it? I mean, is there a payment, a way of paying for that? You know, for coaching and practices, or is there anybody who's doing that in a realistic way? I guess payment model, I guess, is the phrase I was looking for.
To train coaches.
Right. Well, to have coaching within a practice for
So
patients.
you can hire health and wellness coaches. Yes.
Okay.
Absolutely. Yep. And they're specific to just, you have coaches that are executive coaches. You have coaches that are marriage coaches, relationship coaches, and you have healthcare and wellness coaches. Absolutely, yes.
Okay. Thank you.
All right. Okay, everyone, I am going to stop recording and I wish you all the best. Thank you again and good luck.
Thank you.
Sure.
Thank
Bye.
you.
Thank you. Bye.